tonight we're discussing a very exciting topic. It's called regenerative medicine, reversing chronic disease. And I'm going to be speaking, and also my associate, Dr. Pachani, will be talking as well. Both of us have been using these modalities for a number of years, and I've been practicing here for 33 years now, and regenerative medicine is a big part of our practice. So what we're going to do tonight is Dr. Pachani and I are both going to take turns discussing different topics. We have 5 major topics that we're going to discuss. He's going to discuss initially stem cell therapies. I'm going to be discussing something called exosome therapy, and we'll be explaining what that is. Then Dr. Pachani will be discussing PRP, which stands for platelet-rich plasma. I will be back and discussing what's called therapeutic peptides. This is new cutting-edge information. And lastly, that is the last thing. So he'll be discussing prolotherapy as well, along with the PRP. So that's the agenda for tonight. And I think you're in for an exciting evening, and we certainly welcome your questions. So with that, I want to introduce you to Dr. Brett Pachani. Thanks.
Okay, so let's get started. I'm going to try to make my portion of the talk hopefully a little bit exciting, not too long-winded, and just give you some introductory information about a couple of topics that hopefully you can ask questions about, do some research on your own regarding these things, or come and see us and find out more about it, and we're here afterwards if you have questions as well. So a little bit about sort of regenerative medicine, right? What is regenerative medicine? You know, you hear that term, and it can cover a lot of different facets of medicine. Generally here, what I do is sort of musculoskeletal health and wellness. So my background is in neuromusculoskeletal medicine, sort of sports med, PM&R type stuff. I do some hands-on manipulation as well, along with a lot of injection therapy, which is part of the regenerative stuff that I do here. So basically, regenerative medicine is sort of regenerating human cells, right? Tissues or organs to restore or establish a normal function. It's very promising. It's sort of new. It's kind of like Dr. M said, latest and greatest. And there's a lot of new information coming out all the time, and we're constantly learning. So some of this stuff has been around for a while, but there's new things coming out all the time, and new studies and new articles to show how it works or how it doesn't work and what to use it for. But basically it refers to a group of biomedical approaches that may involve the use of stem cells or fluid secretions from the stem cells, i.e. exosomes, which Dr. M will get into. And some of these cell therapies include injections of stem cells or progenitor cells, immunomodulation therapy, and tissue engineering, like transplantation of lab-grown organs and tissues that you may or may not have heard about. And current estimates in some realms indicate that approximately 1 in 3 Americans could potentially benefit from regenerative medicine right now. All right, so that's a pretty good number. All right, so some of the uses in my world for regenerative medicine, some of the things you see up there. Osteoarthritis is obviously one of the biggest ones that I see almost every day. But things like TMJ and joint dislocations and sprains and strains, headaches, back pain, lots of other things. Not only these things here, but now regenerative medicine and the use of stem cells is being used for autism, Parkinson's disease, MS, lots of different things. So it's in cardiac health and wellness. So it's really running the gamut now, but primarily what I see here is stuff that relates to the musculoskeletal system. All right. So cell aging, right? So obviously, as we age, so do all of our cells, right? Think about it. There's 2 pictures of a hand there. Obviously, the one on the left, much younger than the one on the right. And some of you probably see those changes happening in yourself over time. I know with me, I feel this differently now than when I did 10 years ago or 15 years ago. And I always tell patients, think about it like when you're a young child and you fall and skin your knee or something. How quickly does it heal, right? If you do it when you walk out the door tonight, which hopefully you do not do, how long will it take to heal? It's probably very different. And the reason is because your cells, when they're younger, look like that picture on the left, and later on, as we age, they look like that on the right. So the quality of that isn't the greatest, but as you can see, there's much more structure to those cells, and those cells on the left are much younger and much more robust, and they still have the ability to divide, and these cells on the right are older, and they're not dividing as well. They're basically becoming senescent, or sort of lacking the ability to differentiate and divide, and they're sort of in the dying phase. So that's sort of what it looks like as we age, and that's happening everywhere in our body. Okay? So we're all looking for that fountain of youth, and we're going to talk about maybe some of those things tonight. So stem cells and regenerative medicine, what are stem cells? It's basically a form of cell-based therapy with an objective of the damaged organ or tissue to heal or regenerate the activity of it by replacing it with different types of cells and how they can divide, totipotent or pluripotent, and to treat disease, injury, or ailment. So this is the only way really to enable the body to renew itself and regenerate into a healthier state as we age, that we know of right now anyway. It's being carried out around the world all the time. I have patients that I see that say, oh my goodness, I'm glad I found you guys. I was going to travel to Mexico. I was going to travel to India. I was going to travel to Europe to get some of these therapies done because they don't know that they're being done, locally. This includes blood transfusion and transplantation of organs. So again, it's not just thinking about stem cells that might be grown in a lab. It's some of the things that happen all the time, right? And it works similar to those stem cells. Okay, so does anybody, probably everybody here has heard the word stem cells before tonight is my guess, right? Does anybody know what the different types of stem cells are? Hint, it's up there, it's on the board. So it's an easy question, but Dr. Magaziner is going to cover the bottom one, it's exosomes. Those are extracellular vesicles that come from donor stem cells. They're in the fluid. The other three are things that kind of more fit into my practice, and the different ones that you commonly hear about for orthopedic regenerative conditions is adipose-derived, bone marrow-derived, and umbilical cord or placental-derived. Primarily what we use here is the umbilical cord-derived stem cells, and they also form some of the exosomes that Dr. M will talk about. The adipose-derived is taken from a patient through a liposuction type procedure, and some of you may or may not have heard of that before or have had it done. It's kind of fallen out of favor more recently. There was some cases with a big stem cell clinic up in the Northeast, further north and east than up here, and they did some of these injections following this liposuction type procedure and injected them into patients' eyes, and they have since lost vision. So a lot of people not touching it at the moment. I don't know whether or not those injections should or should not have been done, but it works well for certain things, but we've kind of gotten away from it over time, and I don't know too many people that are doing it that often at this point. Bone marrow-derived stem cells is another one. If anyone's ever had a bone marrow transplant or heard about that, that's sort of the same process. They take a pretty big needle and they put it into your hip or your pelvis, and they take out some of your bone marrow. It's taken from you, obviously, and then that's utilized in another area. But it's not very comfortable to have done. It can be painful, and you usually have to be sedated for it, or you have to have a really high pain tolerance. And again, we don't like doing that, and we don't really have the capability to do that, so we're not really doing much of that here. The umbilical cord and the placental-derived stem cells are from a donor. Those are usually what we get here. They come from a lab, and we use those for lots of different conditions, and they can be given in multiple different forms and fashions, IVs, injections, things like that. And then the exosomes, like I said, we'll talk about a lot more as the talk goes on. Most commonly, these things are injected for tendons, ligaments, and joint disease with what I do. All right, so a little bit more about umbilical cord stem cells. These, again, are derived from umbilical cord blood and placental tissue from healthy donors that signed consents and allowed that stuff to be taken. It contains a lot of hematopoietic stem cells, which come from blood products, obviously, and they are undifferentiated. So basically, they are unsure what to do with themselves, and they don't really know what they want to become yet. But the nice thing about them is that they are very, very young, so they are basically the youngest stem cells that are available. Because if we were to harvest stem cells from you, your stem cells are as old as you are. These are basically day zero cells. So again, you're getting sort of the best of the best. You're getting cells that are undifferentiated and that are robust and that are ready to divide and work. You're not getting cells that might be 40 or 50 or 60 years old. They are all screened for infectious diseases, just like any other blood product would be, like if you were to get a blood transfusion. And they send us those testing results when we order the products. And then there's no need for bone marrow or adipose collection, obviously, so you don't have to go through that painful part to get them. Primarily, these things are really good at doing the things on the screen at the bottom: decreasing inflammation, increasing vasodilation, increasing angiogenesis, or meaning bringing blood to an area, and possibly increasing vessels, and increasing your own division and own stem cell production. Okay, so that's kind of how they work. All right. So again, umbilical cord stem cells, they are pretty safe. There's a lot of published articles, more coming out all the time. Most of the largest stem cell companies in the world are using these allogeneic cells. So allogeneic means that it comes from somebody else or a donor. If they're said autologous, it means it comes from you. So the bone marrow and the adipose-derived are autologous. Anything that comes from someone else is allogeneic. So that's what that word means. And cell therapy in general is mostly going allogeneic at this point because the results seem to be better. And there's a lot of evidence pointing towards umbilical cord stem cells having efficacy and basically just being a better choice because they're working better. Okay? And that's primarily why we are using them. All right, so again, one of the things that I see most commonly is arthritis, right? There's different forms of arthritis. There's rheumatoid arthritis, there's osteoarthritis, there's spondyloarthritis. But we're talking about run-of-the-mill sort of osteoarthritis, the wear and tear on your joints. And over time, right, you lose the cartilage or the cushion in these joints, and it leads to pain, inflammation, irritation, and lack of mobility. So lots of my patients have this in different areas. Over the last few years, a lot of scientists, researchers, clinicians, surgeons have gone through lots of testing and studies to kind of figure out ways to repair cartilage and postpone the need for joint replacement. That's commonly like the most frequent thing that I get, asked about. I don't want to have surgery. I don't want to have a knee replacement. I don't want to have a hip replacement. What can I do? So that's why we're bringing it up at this point. Your stem cells, just on your own body, can drastically speed up the healing process because we all have stem cells floating around in our bodies right now. It's just that as we age, they age. Okay, but these stem cells can be injected IV to assist in generalized healing, and also locally into the joints, right, to kind of help with things, right? So we're not saying that they're going to recreate your knee from 20 years ago, but the results look pretty good at this point for most patients. All right, so here I'm just going to talk about a couple of studies for osteoarthritis of the knee and stem cell therapy. So these are some of the most frequent studies that came out. So you can see on the left, all of them were done in 2019. Those are the lead authors there and the number of patients. Now again, these don't have thousands of patients in these studies. They're relatively small, but these all show very good results with the cell type there. Follow-up usually at 6 or 12 months. So again, studies that you do, and you do a 1-month follow-up with maybe a steroid injection and saline or a placebo and stem cells, the results are probably all going to look pretty similar because you haven't really given it enough time yet. And all those things, those other things usually wear off. They're a Band-Aid. They don't really heal and they don't regenerate. So the follow-up later on is what we're really looking at. And you can see the safety of these things, right? So there's no serious events in that top study except for a couple of people said that there was pain and swelling short-term afterwards, probably just from the injection itself. The second one there was 6 patients that had some pain and swelling, but again, very minimal, no serious adverse effects within 12 months. And the bottom one, again, not much happening in terms of side effects. And then these are the outcomes, right? So in the top one, you have, these are just different scores for different tests that we run that are basically subjective. But there was a 69% improvement in both treatment groups for the one thing. And there was a trend toward greater disease stabilization overall. The second one, there's statistically significant articular cartilage repair seen, which nothing else is really doing that at this point other than stem cells. And the size of the cartilage defect in one part of the knee, in this bottom one, in serial MRI scans remain stable, but all of their subscores significantly decrease, which means usually pain, mobility, functionality, all those kinds of things. So again, pretty good results, even though it was a small study. There's hundreds more of these every month, and you can look at clinicaltrials.gov to find all of them. And if you just type in stem cells and a disease or something like that, you'll see lots of things populate. But I just picked a few for now to talk about. All right, and then, so some of the other things that, like I said, these are not just being used for things that I do with joint disease and musculoskeletal medicine, multiple sclerosis, Alzheimer's disease, cardiac conditions, post-stroke, autism spectrum, lots of other things, and Dr. M will get into some of those as well. But this is a few things with new studies on multiple sclerosis and stem cell therapy. And as most of you probably know, there's not great treatment out there right now for MS, and that's why they're studying some of these things. So here are 4 pretty recent studies. One's from 2014, the other within the last couple of years. And you can look at these, again, small patient cohorts, and the number of treatments is there, and some only had one treatment versus 7. But again, follow-up at 12 months, 8 years, and then 12 months for the bottom 2. There's only one real toxic reaction in all of these patients, nothing else really to note. And you got improvements in bladder, bowel, and sexual function in the first one, as well as physical function, energy, and fatigue. And then 83% showed no disease progression on their MRI a year afterwards. So that's pretty significant. Improved scores for pain and other indices on the second one, as well as reduced cytokines that are inflammatory in the body that were tested, and reduced foci on MRI. So it actually means that there was some reversal of their disease. This third one here, no statistically significant improved results, but improvement trends in leg and eye potentials and lesions on the MRI was seen. And then the bottom one, steady disease course and fewer instances of relapse with significant change in the cytokines again and improvement in their functionality. So not all of them looked at MRIs and other things, but just kind of looking at the broad scope of the patient this far out is showing a lot of positive signs. All right, I think you're up.
Okay, any questions so far for Dr. Pichani?
What was that website? It was
The website is clinicaltrials.gov.
Okay, thank you.
Great, thank you. So what I'm going to talk about for the next few minutes is something also extremely new and cutting edge. And I only learned about these substances called exosomes about a year and a half ago. I was at a conference and went to a conference on regenerative medicine, and I listened about stem cells and listened to various other things. And all of a sudden, there was a talk on exosomes, and I was thinking, what are exosomes? I never heard that term before. I didn't learn about that in medical school for sure. Anyhow, so they gave a talk on this. There were several talks on it, and the bottom line is, what are exosomes? So they are secreted by cells, first of all, and all cells, believe it or not, secrete fluids. And the stem cells, in particular, secrete certain fluids that they've identified and termed exosomes. They are what's called extracellular vesicles, which means basically bubbles filled with secretions. So what are those secretions? They're primarily made up of about 5 major things. And they are what's called RNA. Did you have biology or chemistry class and heard the term RNA? Timmy did. Okay, very good. So they contain what's called micro-messenger RNA, and these things help to repair proteins. And they encode for making proteins to help repair our tissues. They also contain various proteins. They contain various immune factors, and in particular growth factors. And they also contain different lipids and various other components. So once again, they're secretions from the stem cells. And some believe that one of the reasons why stem cells work is partly because of the exosomes or the secretions coming from those stem cells. Now, when we are aging, and when we have chronic disease, there's a few characteristics that occur. And virtually all chronic diseases have some commonality. Number 1 is generally excessive inflammation going on, so a lot of inflammation. Number 2, there's generally a reduction in what's called mitochondrial function. Timmy, you know what mitochondria do? All right, good. So mitochondria are there's thousands of them in our body. Every cell has thousands of mitochondria. They help us make what's called ATP. And that's how we derive cellular energy. If we have certain chronic diseases, the ability for these mitochondria to work well, they decline. They no longer make enough ATP for energy. And if we don't make enough ATP, our cells sort of die off and they become diseased. So that's the second major factor in the aging process. The third is what's called cell senescence, which Dr. Pichani alluded to. Basically means that the cells are no longer able to divide properly and they kind of fall asleep. They become zombie cells, in a sense. And they don't divide anymore. When cells stop dividing, if they're supposed to divide more, they lose their ability to function well. Furthermore, when they're senescent, they no longer communicate well with the cells around them. And so you lose communication and you lose what's called cell signaling. If that happens, our cells begin to die off and we can develop chronic disease as well. Another commonality in chronic diseases in the aging process is we lose the ability to repair when there's damage in our tissue. So part of this thing called senescence, and the other term is called autophagy, is that it's the ability for the cells to repair themselves if there's a little break or damage in the DNA. So part of what we're trying to do here in regenerative medicine is to repair all 6 of these characteristics. And there's a lot of what's called reactive oxygen species in these cells as well when there's chronic disease. That means a lot of free radicals forming. You've probably heard that term, and you heard the term antioxidants. They protect against oxidative stress and what's known as reactive oxygen species. So what we're trying to do here is improve the function of all 6 of these things. And that's where this regenerative medicine comes in, and I'm going to talk about how exosomes can help that. Right? So when we're using these exosomes, we're getting them from the umbilical cord. It's called mesenchymal stem cells. We're not getting them from your elbow or something like that. We're getting them from healthy umbilical cord blood, as you said, day 0, basically. And they are tiny, tiny substances. These exosomes are approximately 100 what's called nanometers in size. They can't be seen with the naked eye. They're the size of a virus, basically. You have to look under maybe an electron microscope to perhaps see them. But anyhow, so they're filled with these fluids that encode for different proteins and help communicate from one cell to another cell to another cell, so that cell can repair itself, so that cell can function better, and it helps to improve what's called cell signaling. Okay? And these substances, once again, are very anti-inflammatory, and they are immune. They modulate the immune system, basically. So they can help function. They can help the improvement or help improve our major organs: the brain, the heart, the liver, the spleen, the lungs, the skin, skeletal muscle, tendons and ligaments and cartilage as well, spinal cord, and the overall immune system. So they have the ability to repair where there is damage or degeneration in the body. They seek those out and they can help repair it because it's anti-inflammatory and immune, what's called modulatory effects. So I'm going to talk for this is different categories. So first is the immunologic effects or the beneficial effects in regard to exosomes. And by the way, these things I use much more for systemic conditions, systemic diseases, whereas we use more of the stem cells perhaps for, at least in this office so far, for more of the arthritic and the musculoskeletal problems in the joints. It's very, very good for repairing the joints. But the exosomes I'm using primarily to repair degenerative systemic diseases. So for example, they're very, very good for some of these autoimmune processes. And there's thousands of Americans now. Unfortunately, who are developing chronic autoimmune diseases. In fact, they're doubling about every 15 years now. It's that much. When I was in med school, we hardly heard of autism or PANDAS, which is an autism spectrum type of thing. We didn't see a lot of lupus. We're seeing these things now, not only more often, but also in an earlier age than ever before. So Crohn's disease, ulcerative colitis, lupus, thyroid, Hashimoto's thyroiditis are an example in diabetes of frequently immune dysregulated conditions that might be improved by these exosomes. Right? The next, and truthfully, there are paper after paper now. It's exploding in this field. Just like you showed you the stem cells, the exosomes are also exploding as far as the research that's being done now by scientists and researchers. So this is one where they didn't inject the eyes, they gave it intravenously, the exosomes, and they showed great improvement in autoimmune, what's called uveitis, and iritis, and blepharitis, which are eye conditions that a lot of people struggle with. So this is another paper that it just says mesenchymal stem cells secrete immunologically active exosomes. So these are all new, by the way. This research in exosomes is probably only in most of the last 5 years, and it's just booming right now. Orthopedic, Dr. Pichani talked about the stem cells, but we also can use some of the exosomes for this as well, and sometimes we use both in patients. But anyhow, so they help improve muscle metabolism, and they help to improve and reduce pain in the joints and tendons. They can also be useful for degenerative arthritis, or what's called osteoarthritis, and also for rheumatoid arthritis, which is actually a autoimmune disease itself. And so, once again, there's paper after paper to talk about the clinical aspects and the therapeutic effect of the orthopedic application of exosomes as well. And this is just another one example. What about heart disease? Well, I do see a lot of patients who've had heart attacks, who have what's called cardiomyopathies, which is a weakening of the heart muscle itself, who have congestive heart failure. And exosomes are tremendous at repairing degenerative tissue in general, but it's specifically heart, and I'm going to talk about brain in a minute. So when we see people who have recurrent or they're not responding to treatment, to the traditional treatments of angina, which is chest pain, or they've had a heart attack and there's damage to the heart muscle, there's no real drug out there right now that can help repair the actual muscle of the cardiac myocardium, okay, after a heart attack. this is one thing that actually may repair it. And when people have congestive heart failure or the cardiomyopathy, which often occurs from too much alcohol intake, by the way, once again, exosomes are reparative, they're anti-inflammatory, and they may help regenerate tissue back to normal. And also, COPD, which is chronic obstructive lung disease. I have a patient I'm treating right now with that. We have a few patients we're treating. It's not too uncommon. People with emphysema, people with former cigarette smokers, and we can turn that around sometimes to a degree by using these exosomes. And like he said, we don't know the answers yet. This is new information. There's still a lot of studies to be done in this field. But anyhow, so this is just one study in regards to repairing cardiovascular disease. I treat a lot of people who've had heart attacks, and this is something I'm now introducing to my treatment modality. One of my colleagues is a cardiologist, by the way, Californian, and he has introduced this to his practice as well. So it's an exciting thing, and I think over the years we're going to see more and more. What about neurological diseases? And I think that this is an area that probably will have the greatest application for exosomes as we move ahead. So we all know that we all fear dementia and Alzheimer's, and there's no current effective treatment for those conditions. They've developed various drugs, as you might know, dozens of them kind of have been approved or almost approved, and in research, and none of them work very well. So the exosomes is an area that may greatly help dementia, Parkinson's, multiple sclerosis. So we mentioned about the stem cells from MS. This is another modality that may help. Also, peripheral neuropathy. It's very difficult to treat, and often occurs from medicines, especially chemotherapy, or from diabetes. And neuropathy seems to be you get numbness and tingling in your extremities, particularly in the feet and legs most of the time. But anyhow, this is one modality that I'm starting to use now for our patients. Traumatic brain injury and concussions. We hear about all the athletes today that have concussions. There's a lot of things you can do now in the regenerative medicine field to repair the damage that's been done to the brain. This is one of them. Cerebral palsy and autism. There's some papers on autism, which I'll show you in a minute, whereby these exosomes may show some promise. All right. So I Googled the other day, it's called PubMed, which is a site that a lot of physicians use to see what scientific papers exist on a particular topic. So I happened to put in exosomes in regenerative medicine, and you see here that there's nearly 500 papers that appeared over there, just on this topic, and then I put exosomes in and just degeneration without the word disease, and another 179 showed up there as well. So you can see that, and these are all current. There's more and more coming out in this field, and I think over the years it's going to be more and more. So what they do is they help to repair damaged tissues, and they actually improve synaptic communication. Synapses are the cells in our brain that help us communicate better, and they improve the circuitry. So if you're an electrician, you understand what that means better than I would maybe, but the problem is when we lose the ability of our cells to communicate from one to another, that's when cells degenerate and die off. And with all these neurologic conditions I just mentioned, that is one of the major problems. So, and especially with just head injuries, car accidents, there's not much you can do sometimes from a conventional standpoint. This may show some promise in reversing those conditions. Here's an article I just found the other day. Exosomes may hold the answer to treating and diagnosing developmental brain disorders. What they do is they carry their cargo, their contents, once again from one cell to another, and they influence what's called the expression of those cells. So even if there's been a major injury, they reduce the inflammation in those cells, and they actually can repair it. So very reparative. This is just an article on traumatic brain injury. I mentioned it can be very useful for concussions as well. This is an article that talked about using exosomes intranasally, meaning through a nasal spray, for autism. And so we're starting to use this now. We're doing it both intranasal and also sometimes intravenous. So this is something that looks promising. We're not sure, how effective it's going to be, but there are some papers that are coming out to this effect and may offer some promise. There are some miscellaneous applications of this as well. So one is in the ophthalmology field, macular degeneration, which is a leading cause of blindness. And happens unfortunately as we get older for some of us, and this is something that may repair that. But only what's called dry type. There's a dry and a wet, and if you have the wet kind of macular degeneration, that's actually a relative what's called contraindication. So we don't recommend it for the wet type, only the dry type. Also, cataracts. Rather than maybe before having surgery, instead of having surgery, this is something to consider trying. And also what's called retinitis pigmentosa, which can also cause blindness at times too. Wound healing. I have a picture upstairs in my exam room of a man that had a second-degree burn. They used the exosomes just topically on his face. Within 1 week, it looked probably 50-60% better. Within 6 weeks, it was 99% better. Just by using them topically. They're extremely effective for wound healing and skin repair and keloids, which are these, keloids are these, how do you explain it? These ropey things that form from scars in some individuals. They don't heal as well as other people. They form a very thick kind of scar. But anyhow, so this may offer some promise. Burns as well. Burn victims may do very well with these exosomes. Also, any kind of liver disease, even things like hepatitis and that non-alcoholic fatty infiltration liver is another condition. Kidney disorders, peripheral neuropathy, I mentioned that earlier. Sexual dysfunction, urinary incontinence, and then there's a lot of aesthetic applications. There's some suggestion that may help with the appearance of our skin, especially on the face, and also maybe help with hair growth. In some cases, I personally think it works better in women than it does in men. But there's papers about the use of it in cases of alopecia and hair loss. And it also can be used along with the PRP because it functions as a very good what's called scaffold. So with PRP, sometimes we add some additional, until we talk about PRP in a minute, what it is, but we add some other modalities, and we often can add stem cells or exosomes in with the PRP to get an additive and more effective result. And the other application we can use this also for type 2 diabetes. I just had a patient in yesterday who's been fairly refractory, even though he's been following great nutrition, he's exercising, he's taking supplements, he's eating mostly plant-based. His blood sugars are still very high, and so is his A1C. So we're going to start him on this program now and see how he progresses. Incidentally, had another man in yesterday who followed exactly what I just said, mostly a plant-based diet, exercise, weight loss, some supplements, and his A1C dropped significantly, his blood sugar dropped significantly, it feels amazing. So you can see how we're all different and we respond differently to the same stimuli and same treatments at times. All right, so some of the advantages of exosomes in general. First of all, they're acellular, which means they have no cells in them at all. They're not cells, they're fluids. So they can't transfer, you're not transferring DNA from one person to another. Some people are concerned about exosomes, saying, hey, well, can I get disease from that newborn baby? Chances are very slim that would happen because there's no cells and there's no DNA in there. Okay? Number two, they don't function as foreign proteins in the body at all. They're not perceived as foreign in the body. And the other thing is that they don't typically get what's called stuck or sequestered, or they don't clump in the lungs. One of the arguments about stem cells, because they're far greater in size when you give it systemically, intravenously, is that they might get stuck in the lungs. Whereas these don't get stuck because they're way smaller and they circulate more readily. And in fact, these will cross the blood-brain barrier where cells typically don't. So in our brain, we have a barrier. It's called the blood-brain barrier, to not allow certain things to get to the brain. This is one of the few things that can get into the brain, and therefore that might account for some of its regenerative properties. And they're well tolerated. You typically don't get fevers or chills from them. You don't get anaphylaxis. Whereas the slight chance that might happen with stem cells, and usually doctors may pre-treat patients who are getting intravenous stem cells, perhaps with synthetic or some steroids sometimes before. It doesn't happen too much, but it can happen. With the exosomes, it doesn't happen much at all. It's almost unheard of because, once again, there are no cells in these fluids. Okay? And they're a little bit less expensive, typically speaking. Now, there are some what's called relative contraindications, which means we probably wouldn't use them in these conditions. They're not what's called absolute contraindications, which means you absolutely shouldn't use it, but they're called relative, which means you better use your best judgment. And so, for example, if someone has an active cancer, we typically do not use exosomes on them. If they're pregnant, I would not use exosomes either. We just don't have any data on that. I'm not taking a risk on that. There's various other conditions, something called myeloproliferative diseases, which has to do with your blood, abnormal blood cells that form bone marrow problems, sickle cell anemia. So a lot of the different blood disorders, we would not typically use exosomes in those cases. And if you have a type of what's called pulmonary hypertension, an acute bacterial infection, we wouldn't want to use exosomes either. And if you had some recent dental work, and if you had, I mentioned, the wet macular regeneration. So that's it for my little talk here. Do you have any specific questions about the exosomes? And typically, by the way, they're delivered a few ways. The most common way that I'm administering them now is number one, intravenously, mostly for anti-aging, for regeneration, for longevity. A lot of people come and say, I want to feel better, I want to look better, I want to feel, like I did 10 years ago. This may be something very exciting for them to try. The other major area I would tell you that I'm using it for are the neurodegenerative diseases, because, as I said, cross the blood-brain barrier, and it's one of the few modalities that may actually help some of these patients. So I think it's very promising. We need more research still, of course, but I think it's something for the future that's going to play a major role in regeneration of tissue, diseases in general. Any questions about that? Okay. So for that, I'm going to go to Dr. Pichati, and he's going to talk further about what's called platelet-rich plasma, which is abbreviated PRP.
How's everybody doing? Are we boring you to death yet?
No.
Okay, great. Does anybody need to get up, stretch, move around, anything? We're okay? All right, this portion of my talk will be pretty quick. Really just going to go over platelet-rich plasma, or PRP, and prolotherapy very briefly. It's just a couple of slides. This stuff has been around a little bit longer than stem cell, or much longer actually than stem cells, so it's not quite as new. A lot of people have heard about it and or tried it, or maybe know somebody that's tried it. But again, it's just going to be a brief introduction, and if you have questions about it afterwards, I may read you a little letter about prolotherapy here. So platelet-rich plasma, it's basically been around since the 1980s. It comes from your own blood. So what do? We take your blood, right? We draw it like you would for a regular lab test. You put it into vials and it gets spun in a centrifuge very quickly for about 10 or 15 minutes. It contains, and you basically are concentrating the different layers of the blood, and you get this like straw-colored, see-through solution, which is your plasma. It has lots of platelets in it, lots of cytokines, growth factors, some of your own stem cells, other things. And these growth factors stimulate healing. And it says, although blood is mainly a liquid called plasma, it also contains other components, right? Red cells, white cells, platelets, and these platelets are best known for their importance in clotting of the blood. Platelets also contain hundreds of proteins called growth factors, which are very important in the healing of injuries, along with your own stem cells. So those are the factors that we're getting in some of the cells. The nice thing about PRP, for me, I'm putting it into joints, or I'm putting it into damaged ligaments, soft tissue, muscle, meniscus, labrums, things like that, is generally there's no reaction because it comes from you, right? So there's really no chance that you're going to get anaphylaxis from it. You may get a little injection site reaction, but that's it. It's usually very, very minimal, and it works very, very well for most things. So it's much less expensive than stem cells. It's an in-off procedure that does not take very long. The longest part of it is your blood spinning for 10 or 15 minutes, but it can be very, very effective. All right, and then this is just a study. I know this has a lot of words on it, so don't have to read all of it. But basically, this was a study that was done at the end of last year with 4 different subgroups for injections for hip osteoarthritis, right? Hip arthritis. So they did PRP injections, hyaluronic acid injection, a corticosteroid injection, and hyaluronic acid plus PRP. And basically, they looked at these different pain scores at 1, 3, 6, and 12 months after the procedure. And this was a total of 11 trials with 1,060 patients, so much bigger than those other trials that I talked about with stem cells. And as you can see, that the most efficient agent in hip osteoarthritis in the short term, 1 month, 4 weeks, was steroid. And it kind of makes sense. It's designed to get rid of your inflammation and help your pain. So within 4 months, it probably did that a little bit better than anything else. And then after that, it wore off quickly, and it was basically a Band-Aid. And if anybody's had that done before, you probably had a similar effect. And what do they tell you? Wait a couple months, we'll do another one. Wait a couple months, maybe we'll do another one. Well, you're also eating away at your healthy tissue by doing that, because steroids are getting rid of inflammation, but they're breaking down your own tissue. So we don't recommend those too often anymore. But a lot of times I see patients that have already had them, they didn't work, and now they're looking for something else. PRP is reported to have the highest rank for pain relief for up to 6 months, and they're just saying that future studies are needed. But basically, if you look at the results here, out of the 5 different interventions, PRP had the lowest sucra value, which is just the testing that they did for the value at 6 months. So again, basically what we're saying is PRP works best long term. It's not a Band-Aid. It's not going to be a quick fix, but over time it's going to work better than most of the other things that are sort of considered traditional standard of care at this point. Okay? And this study was just done last year looking at 11 different trials with over 1,000 patients. Okay? So the numbers are there. All right, and then prolotherapy is just something else that I do here. It's under sort of the regenerative umbrella. This has been around for a very long time. There's reports of it, being dating back to 500 BC with Roman soldiers, although it wasn't really referred to as prolotherapy at that point. It was came from sclerotherapy, and back then they were basically using it for stopping wounds from bleeding and healing. Sometimes they were using sclerotherapy with agents, or they were just burning it shut, basically. But it kind of is the same sort of effect. And then sclerotherapy came around in the 1930s when this was sort of discovered, and included both joint and vein injections. Now prolotherapy is basically used for all the musculoskeletal applications, the tendons, joints, ligaments, and sclerotherapy is more for varicose veins, spider veins, hemorrhoids, and other vascular abnormalities. But if you've heard of one or both of those things, they're basically doing the same thing, but they're using a different terminology now. So prolotherapy is essentially non-surgical ligament and tendon reconstruction and regenerative joint injections. It basically stimulates the body's healing process to strengthen and repair the injured and painful joints and the connective tissue. So what do we use? Primarily lidocaine or procaine or marcaine, which is an anesthetic, and usually simply dextrose solution, which is a fancy way of saying sugar water. That's usually the easiest to get, the cheapest, and it's pretty safe and effective, and it doesn't cause a real inflammatory reaction short term. But you can use other solutions like phenol, glycerin, sometimes hormones like testosterone, or some people use growth hormone and other things. In certain places, sarapin that comes from a plant. Tremel is another thing that's a homeopathic remedy that was developed in Germany that has minerals and some other things from plants and herbs in it. Glycerin, sodium moruate is another one. So there's lots of different options. But usually we start with dextrose because it's very simple, it's easy, it's relatively inexpensive, and patients tolerate it well, and it works. And a lot of the studies were shown using dextrose, so we have a lot of information on it. And again, it's for regeneration, and primarily for what I do, it's for injury, right? And it's, but we use it for arthritis, we use it for muscle damage, all the other things that we talk about with the stem cells as well. But it's just another option, and it's been around for a long time. It's very safe and effective. So I'm going to read a quick letter, and then I'm going to let Dr. Magaziner get back up here. This is actually from 1981, September 2nd, 81. This is from a professor of pediatric surgery at the University of Pennsylvania, who was also the Department of Health and Human Services Deputy Assistant Secretary of Health. And he's writing to basically say that he's telling this person about his opinion of what he called sclerotherapy, but what he's referring to as prolotherapy. He says, I not only have used sclerotherapy innumerable times for the control of pain, but I myself have been the recipient of this treatment modality and can tell you beyond any shadow of a doubt that this is an efficacious treatment. All I need tell you is that 2 competent neurological groups independently diagnosed my pain as intractable. So he himself had intractable pain. And after prolotherapy, it says here, I returned to an active surgical life. So he was able to do surgery again that he wasn't able to perform because he was in so much pain. And he says here, I've had no recurrences of pain that could not be treated by repeated prolotherapy. He says that the guy who helped develop prolotherapy, Hackett, his original microscopic studies on small animals was obviously a primitive use, but to be sure, better technology has more recently arrived at the same conclusion, stating that it works in not only animals and in larger animals, but also in humans. And it says that he would like to thank them for their local concerns that treatments with prolotherapy might become a charged item for Pennsylvania physicians. So basically, he's writing to them to try to convince them to get coverage from not only the physicians, but also from the insurance companies. So that was in the 80s that happened. We're in 2020 now, and insurance companies continue to say that prolotherapy is not the standard of care, and that it doesn't work, and that there's not enough evidence behind it. I think it's a bunch of crap. But we don't control them, so there's typically a cost involved for some of these things, but they're not a band-aid, and I think that they work a lot better than some of the things that they will cover and that they will pay for. So I think that's it for me. I'm going to turn it over to Dr. Magaziner again and let him talk about some peptides.
All right, thank you. So, this is an area that I've been dealing with a lot in the last year or so. And about a year and a half ago, I was at a conference, and I heard all these doctors, I'm at lunch, and I heard these people speaking about these funny name things. One was called cerebrolysin, one's called kindus alpha 1. What are you guys talking about? So they said, well, we're using these peptides in our practice. And I said, what's that? And they started telling me more about it. And I said, how do I learn more? And they started telling me that these conferences that they're going to. And little by little, it started to make some sense to me. And I said, I have to attend one of these conferences. So I've attended about 3 of them right now in the last year and a half. And using these quite a bit. We have probably over 100 patients now on these substances called therapeutic peptides. They are not one substance. There are multiple substances. There's over probably 75 to 100 that are now available to us to be used in our clinical practice. So what are they? Well, first of all, before we talk about what they are, I want to tell you that these peptides they're being greatly researched right now for various conditions, but the number one condition is probably oncology, followed by different metabolic problems as well. And there are hundreds and hundreds of papers now coming out on this topic. There's cardiovascular papers as well, and things for autoimmune disease, and also for repair of the joints and tendons. And so you can see here, oncology is the number one area that's being researched with these substances, and there's different ones called phase 1 through 3 trials, and many of them have been approved so far, and also different metabolic problems, whether it be diabetes, and a bunch of other things called different autoimmune diseases, basically, is what they're studying a lot too. So anyhow, what are peptides? So they're short chains of amino acids, usually less than 50 amino acids linked together, and there's certain sequences of them. And our body actually makes over 7,000 of these peptides that have been identified so far. As I said, about 75 to 100 are now commercially available, and many of them have been FDA approved. Some are in what's called the orphan category, but many of them have been FDA approved. And they are highly specific. They help to treat various aspects of cell communication and cell signaling. They work very well hand in hand with these exosomes as well. And they work as what we call cell signaling molecules. They help to transfer information from one cell to another as well. And they tell the other cells what to do and to act properly and to how to repair themselves as well. They're highly specific. They're very safe. They're well tolerated. And there's over 140 now being evaluated in clinical trials. And there's many in what's called preclinical trials, over 500 or so. So what they do is, number one, they help to reduce cell senescence. And that's the thing I said that's in common with the aging process. And if we could reduce cell senescence, we can slow down that aging process in our body. We can reduce some of the chronic diseases that we're seeing today. They also improve athletic performance. They can reduce inflammation. As I said, inflammation is a common denominator also with virtually all chronic illnesses today. Whether you can name it, whether it be heart disease, stroke, cancer, diabetes, obesity, depression, insomnia, arthritis, all of those conditions and many more have common denominator of excessive amount of inflammation occurring in the body, an excessive amount of what's called reactive oxygen species, and free radical formation. They also improve brain function. So earlier I said that these exosomes can cross the blood-brain barrier. They also improve brain function. This is another tool in our toolkit to help. And I see some people say, hey, I'm starting to forget my words. I can't remember what I did an hour ago with my keys. They're developing early dementia. I combine the exosomes with these peptides, and we're seeing some very, very favorable results. They also can be used for aesthetics. So once again, for facial rejuvenation, for hair restoration, are two of the areas. Some of them may help with weight loss. They're all different peptides. As I said, there's a bunch of them. So I'm not telling you that one does all these things. There's different peptides for different purposes. It may help to heal injured tissue in general, helps with wound healing. It also helps with hormone regulation. I use it a lot with my bioidentical hormones. We do a lot of that here. And also, it's very, very good for support in regard to cancer patients because it helps turn on certain pathways and helps the immune system function better. So, basically, we've been using these quite a bit now, and it's another tool to help treat diseased tissue and slow down the aging process. They also influence something called the phenotypic expression of our genetics. So what does that mean? Well, we have certain genes, but just because you have a gene that makes you susceptible to something doesn't mean you have to have that disease. That's called disease expression. So that's called the phenotype too. So what I'm getting at is some of these peptides will influence the expression or the phenotypic expression of the genes in a favorable way. And they influence the interaction and cell signaling. So from a biochemical standpoint, most of these will improve the mitochondrial function, they'll improve what's called the redox potential, and they'll also improve the immune, if there's immune dysregulation, it'll help reverse some of that. So one of the things I do here is I see a lot of cancer patients because people come to us for that purpose, and they're looking for support. And so we have a whole program. It's much more than peptides, by the way. I've been doing this for many, many years. The peptides I just introduced like a year ago to the practice. But these peptides have been wonderful in regards to the immune function. And so some of them help to actually punch holes. They're called pore membrane peptides. They basically help to punch holes into the cell membrane, the envelope of a cell, especially a cancer cell. Some of them make the cell more permeable, so that if you're treating with vitamin C extracts, which is what we do here, or if you're treating even from a conventional standpoint, you're giving chemotherapy, these substances can help pull the chemotherapy or the intravenous vitamin C into the cancer cells more effectively, so it works better. And some of them are what we call tumor targeting peptides, which means they actually can target the tumor itself. They can have a direct effect on the tumor. So there's a plethora now of peptides in the medical literature that are coming out. There's over 500,000 specifically. It's been shown 525 when I googled this specifically for cancer. By the way, cancer peptides. So when I see patients who may have breast cancer, there's another one here. There's close to 50,000 papers now been published specifically on the benefits of these with breast cancer. Very exciting because I see, unfortunately, like cancer, 1 out of 7.5 women get breast cancer in our society. It's a lot, and this might be an additional tool to use along with everything else that we're doing. Prostate cancer, there's about, what did I find here? About, 20-something thousand, 22,000? 22,000 papers in PubMed that specifically are geared towards peptides and prostate cancer. So it's a very exciting area. There's more and more papers. These are some of the specific ones coming out now about the importance and therapeutic effect of some of these different peptides and how they can help benefit in with the treatments, whatever treatment they're getting, even if they're getting traditional or less traditional treatments, these substances may be beneficial. Here's some that help to slow down the blood supply to the tumor. It's called angiogenesis, so it's an anti-angiogenic peptide, and they may help slow down the circulation to a tumor so it doesn't continue to grow. And so some of the 4 of them that I'm commonly using, although there's others, are these funny named things. And when I first went to my lecture and I was listening to the doctor speak, it was a foreign language to me. And I was saying, I don't even know what they're talking about. IRGD and PNC27 and thymosin alpha 1 and MET and Keflin, methionine and Keflin. And it made no sense. But as I started listening to more and more lectures during the 4-day conference I attended, they started falling into place because there's a lot of repetition after a while. You hear the same kind of thing over and over. So I started researching and I started looking at the papers on these things, and I saw that there were in fact a lot of papers to support the use of these peptides in various diseases, not only cancer. So this is one of my favorites, and without getting into too much detail, I'm going to tell you some of the uses for this thymosin alpha 1. One of the best things it can do is help with autoimmune diseases. So autoimmune thyroiditis, Crohn's disease, ulcerative colitis. It also helps with sepsis, COPD, hepatitis B and hepatitis C. Probably missing a couple, but those are some of my, this is one of my favorites for any kind of autoimmune disease and a lot of infectious agents. Lyme disease too is another one. I'm using this quite a bit along with everything else we're doing. And what it does, it helps balance the immune system. It helps activate certain pathways that are beneficial to the human body, and they enhance even something called the dendritic cells, which is a very important cell for immune enhancement. And it also also protects against oxidative stress. And I said oxidative stress and reactive oxygen species are two of the pathways that cause mitochondrial dysfunction, cause cellular inflammation. So thymosin alpha-1 can be used, honestly, for almost anything. And I'm not going to... Anyhow, so this other one's called metenkephalin. That's another one we're using for cancer, and they did a study on 50 patients, and they showed a profound improvement in the lymphocytes, which is a type of white blood cell that helps us to help fight cancer. And this is that particular paper, and it stimulated these pathways with what's called the Treg cells, which are a type of T cell. This thing called PNC27 is very exciting also. It turns out that many tumors, many people with cancer, have a mutation of something called the p53 suppressor gene. So it's a gene that helps suppress cancer. But if you have a mutation of that gene, it's not working right. So you can't suppress the cancer as well. This is a substance, a therapeutic peptide, that may actually reverse the p53 suppressor gene mutation, which is fantastic. And so people who have, for example, a condition called actinic keratosis, almost 100% of them display a mutation of p53. These people, in my opinion, should be on this PNC27 to help reverse the mutation. People with other skin cancers, a lot of the melanomas too, 90% of them might express this mutation, this p53 suppressor gene. This is another agent to think about. And we can use it, it's primarily used subcutaneously. Most of these peptides are given, the patient we teach them how to give it to themselves, and they can take it at home. Most of them are given it with a very tiny, like insulin-sized needle. People who are on insulin for diabetes. And they just give it what's called sub-Q, which means it hits vegetarian fat, and you just stick it in there and you're done. It takes a second. So anyhow, there's a lot of exciting work coming out in regard to cancer, and it's PNC27. There's one on solid tumors in general, and there's various others. The other one that we're using for cancer I mentioned is called IRGD. This helps to penetrate the cell membranes. It's anti-proliferative. It works synergistically, which means it enhances the effect of this thymosin alpha-1 that I mentioned earlier, and it improves the penetration of almost any other anti-cancer treatment that's given at the same time. So that's another one that we're using as well. And then I'll just go over three more. So we're not going all this is just basically to whet your appetite and to give you a little bit of an overview of what we're doing here and how regenerative medicine can play a role in treating so many different things. So anyhow, there's three more I want to talk about. I call these my three favorite peptides. The next one is called cerebrolysin. So cerebrolysin helps improve cerebral function, which means the brain. So it's a substance that penetrates also the blood-brain barrier, which is nice. I've told you that the exosomes can also do that. It improves the ability of the neurons to function well. And it also is very much what we call neuroprotective. So when there's degeneration going on in the brain, dementia, Alzheimer's, things like that, this is something that can help protect the brain cells from deteriorating. And so we're combining this with various other things, including maybe the exosomes. And there's about 3 or 4 other peptides, by the way, that can all work synergistically with this cerebrolysin. So we are using it primarily for neurologic problems, strokes, concussions, traumatic brain injury, Parkinson's, dementia, Alzheimer's, and peripheral neuropathies. Peripheral neuropathies have to be one of the most difficult things for doctors to help people with. You know, they often put you on a drug called Neurontin, maybe gabapentin, and the problem is it hardly works, right? And they have a lot of potential risks and side effects. So this is one of the best modalities that I've seen for peripheral neuropathy. The exosomes may be also beneficial for that as well, I mentioned earlier. And the other thing cerebrolysin can do is it can help with just acute pain, mostly acute or chronic pain, really. And so sometimes I'll just give it by a sub-Q injection. I had a lady in, and I'll show you at the end, a lady in just 3 weeks ago who was involved in a car accident, and she was a brand new patient with me on her first day to see me. And I started talking to her and asked her why she's here. She said, well, my shoulder doesn't move. I can only move it this high up, this high. I said, what happened? She said, well, I was in a car accident 4, whatever it was, months ago, and I could hardly move my shoulder. She went through physical therapy. She went to acupuncture. She tried anti-inflammatory drugs. Not much of a result. So she was diagnosed with what's called acromioclavicular degeneration in the shoulder. She could hardly lift it. So I did some manipulation on her. I'm an osteopathic physician. I did some manual medicine. I didn't get that much results with her either. I did some special techniques. Still was mediocre. So I said to her, you know what? If you'll let me give you a few very tiny injections in the shoulder. And I drew up a needle, and I used some of the Tramiel that was mentioned earlier, which is a homeopathic treatment or homeopathic substance made in Germany. And I used that along with the cerebrolysin. And I just injected a few different areas in the shoulder, and within literally 3 minutes, 2 minutes, whatever it was, very short period of time, she was raising her arm to at least 100, 110 degrees. And she was gaining much more mobility, and the pain simmered down quite a bit. So it was a very fast result, which I was surprised because usually when you have that long-standing of a problem, 4 months, you usually don't get quick results like I saw. But I was very excited. She was more excited than I was, of course. But it was very exciting to see it. So I'm going to see her in a couple of weeks, and we'll see how she's doing still. But so it could be used, is what I'm getting at, for chronic and acute pain. And so there's lots and lots of papers on this. This is one I mentioned earlier. It can help for peripheral neuropathy. Here's one also that may be good for Alzheimer's and various other vascular diseases to the brain. And by the way, Alzheimer's and dementia is probably going to be the fastest growing chronic disease in the next 15, 20, 30, whatever years in our society. And it's going to incapacitate probably more people than anything else we're seeing. And it'll also perhaps maybe more expensive because of the care that's needed for these patients. So I think we need to obviously look for different modalities, and I believe that this will be one of them. And not just this peptide, but several others too. But anyhow, here's another one that talked about using this substance for dementia. So there's a lot of literature coming out of this field about this topic. The other two that I like are both reparative peptides. Whenever there's damage or degeneration in the body, I think about using either or and what's called thymosin beta 4 or the next one, which I'll show you. But anyhow, so this one's tremendous also for autoimmune diseases. And I mentioned that the thymosin alpha 1 is good for autoimmune disease. I will often combine these together to get a better and synergistic effect. So it could also be used for chronic fatigue syndrome or fibromyalgia, all those aches and pains people have. For what's called polymyalgia rheumatica, I don't see a lot of that, just in there. And non-alcoholic fatty liver disease, which is also growing greatly in our society. And that's partly from not only the alcohol, it's non-alcohol, it's from the sugar and the processed foods that is so prevalent in our society today. So people are getting liver disease from all the glucose that they're taking in and developing fatty liver. Chronic dry eyes and also multiple myeloma. So I see about 1 or 2 cases a year of multiple myeloma, and this is one thing I'm going to be adding into treatment purpose. This is the last one I'm mentioning tonight, and it's called BPC 157. I happen to love this one too. This one, by the way, the other two that I talked about, mostly given subcutaneously. The cerebrolysin can also be given intravenously, but you have to give a lot of it, and it adds up cost-wise. So I don't use it that way, but we usually do it by subcutaneous. But this one is very variable in how it can be used too. So it can be used subcutaneously, but it can also be used in other ways. One is a pill, via the capsule. Another one is eye drops. So we have a patient we're treating with chronic dry eyes and what's called Sjogren's syndrome, and it looks like it's doing a damn good job. And the people that so one of the things it does is help to heal wherever you're trying to treat. And I have a lot of patients who have ulcerative colitis, Crohn's, and irritable bowel problems. And this is one of the treatments I'm using now in capsule form. And we're seeing some great results with it. I'll show you a case in a minute. But anyhow, so people with chronic, what's called esophageal eosinophilic esophagitis, which is an esophageal problem where there's too much inflammation due to something called eosinophils, which is an allergic type of thing. People with stomach ulcers, I had a lady in today that's chronic stomach ulcers, and I just suggested this to her today. People with ulcerative colitis, Crohn's disease, once again. So you can see there's a lot of different modalities I already mentioned about Crohn's disease and ulcerative colitis. So we can heal these things, and it's fantastic. Also, it can help heal tendons, or if there's a crush injury, someone's been run over by something, or something fell on them that's very heavy. Periodontitis, which is periodontal disease, which, by the way, that's a dental infection, but it's been associated. It can be associated with increasing risk of Alzheimer's and dementia, and also heart disease. So if you have a dental infection due to what's called periodontal disease, that can increase your risk of heart attack, stroke, and dementia. And that's why it's so important to see your dentist every so often and make sure he or she checks you for the possibility of periodontal disease. So it's important to floss every night too. Corneal injuries, eye injuries, there's eye drops for this. Burns, wounds, and it's also can be used to try to wean a person off what's called proton pump inhibitor drugs. You've heard of Nexium, you've heard of Prilosec, and some of those different drugs like that that they use for stomach problems. This is something to help people get off and yet heal the body effectively. And it can be used to help regulate blood pressure at times, to also help with migraines. So once again, anything that needs healing, this is one, and the other one could be for this called thymosin beta 4 to be valuable. So how do we give these? Most of them are given sub-Q, which is once again a very shallow, small, tiny needle that 99% of our patients can give to themselves. They get scared at first, but afterwards. Transdermal creams. Some of them come in creams, some come in eye drops, and some come in capsules, and some come in nasal sprays. So there's a wide variety. And as I said, there's probably over 75 of these, and they can be applied in different ways, so it's not just one thing. Just to mention another case of a patient, I have a female I'm seeing. She's about 39 years old. Her major complaints for 15 years. Fatigue, headaches, brain fog, can't think half the time. She's only 39, she's young. Frequent infections, cough, congestion, and very, very sensitive to various foods. So I place her on my favorite, which is the thymosin alpha 1. And I also put her on that NPC 157. Once again, because that's very good for stomach healing, gastrointestinal healing. And I saw her about 2 weeks ago. I said, "How you doing?" She said, "I'm doing so much better. No more infections." She said, "No upper respiratory infections at all. No stomach problems now." And she was thrilled. And it only took, it didn't take that long, 3 months maybe she's been on it. She said this has been the best winter she's had in a long time. Well, I recognize it hasn't been so cold this winter too. But we'll take it. You get it. And then the other person I want to mention is, so she's 75 years old, she's been seeing me for a number of years, and has a lot of stomach problems too, and heartburn and indigestion, and she's been on the antacids all these years, and the GI docs just give her new drug after new drug, and doesn't get too far with that. She has GERD, which is gastroesophageal reflux disorder, and she's told she has irritable bowel syndrome, and nothing's been helping her that much. And so I placed her on the BPC 157, I gave her oral pills, and she's had virtually complete resolution of her symptoms. She's probably been on about 4 months too. So she's thrilled with it. She doesn't want to stop because she's concerned, hey, we'll come back. But I think that she probably could stop it and periodically see how she's feeling. But you don't want to stay on these things your whole life either. Whatever we can do to help heal you, so you don't need to be reliant on medications or natural agents or peptides. Obviously, it's good. But yeah, so it's very exciting. These are areas that, it's fertile ground. It's areas that are expanding right now. A lot of research being done. And I just want to conclude to say that, with regenerative medicine, it doesn't mean we throw everything else out. It means we do everything possible. So we do an effective, thorough history, physical, lab work, because we look at everything. We look at toxins in the body. We recommend appropriate supplements. We give different IVs for different purposes here. We use a lot of what's called hyperbaric oxygen and something called pulse electromagnetic frequency, so we're treating with magnets here. We encourage, of course, exercise and meditation, and then we also utilize both the exosomes, the peptides, the stem cells, and PRP. So it's a well-rounded approach, comprehensive approach, because we find that that's the most effective way of treating our patients. And we see very complicated patients, and some have been years, and so it's exciting because this is something new. It's new data. The literature is exploding in this field right now, and I hope in another year or two we can have even better results and more information for you. So with that, I just wanted to open up to any questions you might have and see what we can do to help you. Guys have those questions. Fire away. Come on.
Well, what about for allergies?
Okay.
I know
Excellent.
about allergies.
Yes.
My daughter's, supposedly she was going to an allergist, and they did all these tests and told her she was allergic to all this stuff. And then they kept bringing her back for allergy shots and allergy shots and allergies. And they just, I don't know, they said it's going to take a while for these, but it doesn't seem to be helping.
So the question was, because we're being teaching tonight, is her daughter has allergies, and she's on lots of different allergy shots, and doesn't seem to be helping that much. What can she do? So once again, we do a comprehensive approach for that purpose. And we test allergies here too, which we for. But besides all that, so there's a lot of different natural nutrients that we use to help build up the immune system. And when we have allergies, it means that your immune system is malfunctioning. It's not doing what it's supposed to do. So we might use different nutrients as an example. I personally would probably put a person like that maybe on some peptides because, once again, some are very good for the immune system. They modulate the inflammatory and anti-inflammatory, what's called cytokines. They modulate the T cells and the B cells and all the different cells of the immune system. So we try to get sort of at the root cause rather than just covering up the symptoms. And we've many people that done really well. I mean, I've been treating allergies now for 33 years here. We've done really well in that field. But you have to do more than just give a person allergy shots. You have to really look at their environment. Are they being exposed to certain chemicals? Are they eating properly? Are they getting proper sleep even? Do they have a cat or dog in the house or other animals? Have they just painted their bedroom or they couldn't carpet it? And if the answer is no for those things, then let's build up the immune system and reduce the inflammatory response in the body.
Okay.
Any questions, Susan?
Well, of course, I'm always thinking about autism.
Okay.
Sensory processing disorder. So, Jamie, does it look like on the horizon that there's more hope for the autistic patients?
Yeah, so her question was her son has autism and these are more therapies on the horizon that look promising. And I think so, because there's more and more research obviously being done in that field as well as every other field. And, you know, autism is a difficult condition, but we do know now that probably there's some injury that occurred. We don't know exactly why. There's different theories, you know, is it the immunizations? And not just mercury, by the way, but now the immunizations are being replaced, or the mercury is being replaced with aluminum, by the way. And also all the plastics that we are drinking, the single-use bottles, they contain BPA, but now they took some of the BPA out and they're putting in what's called BPS, which may be as bad or worse than BPA. So what I'm getting at, that also damages our mitochondria, it damages the brain, it damages our neurons. And there's so many insults that occur from our environment, for example. There's over 85,000 chemicals in our environment today that can cause insult to our body. In particular, our fatty tissue, which, by the way, the brain is like 99% fat. Our liver is mostly fatty tissue. So anyhow, there are some things that we're doing, and you know, the exosomes and the peptides may be something to consider. But the answers aren't all out yet.
Hey, Doc.
Even when you think the answers are out, you don't always.
Could you explain briefly, hopefully, why recent dental work might be a contraindication to some of these?
Yeah, so recent dental work might be contraindicated, partly because we need, but that was to the exosomes, not to the
Right.
other thing. We don't want to use it in cases where there's active infections, or we need to heal, where there might be, we need angiogenesis. We need the circulation to the body, and we'd rather not give the exosomes during those times. Anything that's an active condition, we probably wouldn't use the exosomes if it's an acute inflammatory condition.
So I think also it kind of goes back to the same thought process as like you don't have open heart surgery or any other surgical procedure sometimes within a certain period of time of dental work, because when they do dental work, there's studies that show that, you know, the bacteria from the mouth seeds the rest of the bloodstream and can go elsewhere.
Okay.
So you don't want to give another product that may increase angiogenesis and spread that. Same thing like if you have active cancer cells, you don't want to do some of these things because you could potentiate the cancer and you could potentiate that bacterial process.
They'll still say it did it to him through his heart.
So the comment was he had a problem with the heart after what, a dental procedure? Yeah. All right, any other questions? Yes.
Could I just ask you, Dr. Magaziner, about, you know, since we're talking about dental,
Yeah.
if you have a tooth that had been worked on and you find that there's an infection, like after a root canal or something like that, does that mean you have to extract the tooth?
Okay, so her question was, if you have an infection in your tooth and they did a root
canal, and
you have to have it extracted.
You have to have it extracted.
So that's certainly an area of controversy. Now, there's a lot of what's called biological dentists, or more like holistic dentists, who feel that we should not leave a dead tooth in the body. And that's the only time almost in all of dentistry or medicine where we leave dead tissue intentionally in the body. If you're a gangrenous toe, or which means it's dead sort of, they usually take it off. You don't just leave it because you can get infection and sepsis and die. So there's a lot of dentists who are in the biological dentistry field who feel that we should take out and remove and extract the tooth instead of doing this root canal thing in there. And the other problem with root canal is you're leaving, not only you're leaving dead tissue in there, And you're also leaving there's a ton of bacteria inside the root. Now, some of the biological dentists, to try to get away from that, they use what's called ozone therapy in the actual pulp and the root. They use ozonated water, and they use different ozone gas type of things to inject into those areas to help sterilize the pulp and the gingiva to try to kill off the bacteria that's typically seated in there. So you're not going to get consensus on this one from your traditional dentist, but I will say the open-minded, out-of-the-box dentist typically tell you not to have a root done, and they feel that it can cause other medical problems later on in life. Okay. There's sure. I believe I don't know if it's an observation or a real study, but they've shown that women who get breast cancer are more likely to have had a root canal on that side of the mouth, whether it was the right or left side of the breast cancer, more likely to have had root canal at some point in life on that side. Now, that might just be an observation. I'm not telling you it's causing cancer, but it's an observation that's been made. Yeah. Any last question? Debbie?
I have sensory issues, and like peptides may help some of my brain stuff and things.
Yeah.
Maybe.
So he said he has some sensory issues, and maybe these peptides may help his brain function to improve, and that's certainly true. And so maybe that's worth a try. I mentioned cerebral lysin is another one called dihexa, which is used just topically, so that's an easy thing to do. Easier than sometimes giving a shot to a 15-year-old. But just be practical. You have to be practical in life too. You know. So, but there's several. There's about 4 others that have been shown now to improve brain function. So, anyhow, yeah. I mean, we can talk about that later. It's worth a try. Sure. Any last questions? Okay. Well, thanks so much for attending tonight, and we appreciate you coming here. I hope to see you again.